most of the information came from our parasitology books, the pharmacology book, and the big green book that we pretty much use the Bible in here. The thesis statement would be that clients should have to use a heartworm preventative on puppies as soon as they hit the correct weight and age. Heartworm is a parasitic worm that lives in the heart and the pulmonary arteries of an animal. The worms travel through the bloodstream. The severity depends on how many worms are in the system. There are preventatives that actually are topicals, so when you're treating for your fleas and tick-borne diseases and stuff, these actually can help with heartworms. Like Advantage Multi and Revolution. The one I got, which is a chewable tablet, was Trifexis, and it also does the same thing. It treats for ticks and heartworm and fleas. Heartworms live for up to 8 years. They spread by mosquitoes. Once the mosquito bites the animal, in this case I'm just talking about dogs, once the mosquito bites the dog, it leaves the larva, which travels to the heart. This process takes about 6 months to do. The larvae migrate through the body. They're called microflaria. Females do not release the eggs. The microflaria actually grow within the female and then are released as microflaria. They release into the bloodstream, and that whole process takes about 3 years. And once they reach to L5s, they can't reproduce. They work their way to the heart and the cervical vesicles to make it there. They have an indirect life cycle, which means the larva develops into infected stages inside the host, which would be the dog. They're mainly in epidemic or geographic areas, tropical or subtropical areas, but that doesn't mean they won't be around here. The Class 1 heartworm disease is often asymptomatic, no symptoms at all. Class 2 usually exhibits coughing or unintolerance to exercise. The most severe case may show symptoms of anemia, exercise intolerance, fainting spells. One way to detect these is a rapid method is modified knots technique. The procedure requires a mixture of blood and formulation in a centrifuge tube. The mixture is incubated at room temperature for 1 to 2 minutes and centrifuged for 5. The supernate is poured off and dropped in a methylene blue and added to the sediment in a tube. Then transferred to a glass slide for us to evaluate. Additional tests could be done, such as urine analysis, serologic tests to define the female heartworm antigen, x-rays, and things like electrocardiographs. Experts believe that predicting worm burden could provide a useful guide for prognosis and treatment. And then the treatment would be Malaria-Somia dihydroxylin, which is a treatment for adult heartworm. And then the nursing management would be strict cage rest and confinement, heart rate and rhythms, hydration status, and nutritional delivery. So if they were treated before and the preventatives were given, you wouldn't even have to worry about any of it. So as soon as your dog hits the correct age and weight limit, they should be tested for heartworm and put on a preventative. Anybody have any questions? Nothing?
What do they look like?
They're long roundworms.
Okay.
Found in the heart. Anybody else?
Isn't that a heart right there with heartworms in it?
Yes.
You can pass it around. Can you grab that, Bethany? Put that in the video as well, Michael.
Hold that